Hello. In this video, I will provide important information about Meticorten prednisolone. If you find this video helpful, don't forget to like and subscribe to support my channel. Let's get started. What is Meticorten? Meticorten belongs to a group of adrenocortical steroids, corticosteroids. It works by suppressing the immune system and reducing inflammation, making it useful for treating various diseases. The active ingredient prednisolone mimics naturally produced corticosteroid hormones in the body. What conditions is it used for? Meticorten has a wide range of applications and can be used to treat endocrine disorders, hormonal imbalances such as adrenal insufficiency, rheumatic diseases, rheumatoid arthritis, lupus, skin conditions, eczema, psoriasis, lung diseases, asthma, COPD, sarcoidosis, connective tissue disorders, scleroderma, vasculitis. Allergic reactions, severe allergic responses, anaphylaxis. Eye conditions, severe eye inflammation. Blood disorders, leukemia, anemia, thrombocytopenia. Gastrointestinal diseases, Crohn's disease, ulcerative colitis. Cancer treatment, used with chemotherapy for some leukemias and lymphomas. How to use Meticorten. Dosage is determined individually and varies based on the condition being treated. Tablet strengths, 5 mg, 10 mg, 20 mg. Also available in liquid form. Daily doses range from 5 mg to 60 mg. Higher doses may be required for certain diseases, such as 200 mg per day for multiple sclerosis treatment. Take with food to prevent stomach irritation. Do not stop suddenly. Long-term use requires gradual dose reduction under a doctor's supervision. Who should be careful when using Meticorten? Special precautions are needed for people with stomach ulcers, diabetics can increase blood sugar levels, hypertension patients may raise blood pressure, osteoporosis patients increases risk of bone loss, individuals with weakened immune systems, people with glaucoma, eye pressure issues. Pregnancy and breastfeeding. Pregnant and breastfeeding women should consult their doctor before using Meticorten, as prednisolone can cross the placenta and affect the baby. Since Meticorten suppresses the immune system, be cautious about infections. Avoid contact with people who have the flu or chickenpox. Diabetics should monitor their blood sugar levels frequently. For long-term use, consider taking vitamin D and calcium supplements for bone health. Side effects of Meticorten. Meticorten can cause short-term and long-term side effects. Common side effects: fluid retention and swelling, fragile skin, acne, headaches, nausea, vomiting, loss of appetite, heartburn, sleep disturbances, excessive sweating, mood changes. Serious long-term side effects: Cushing's syndrome, moon face, weight gain, bruising, diabetes development, growth suppression in children, heart failure risk, osteoporosis and tendon ruptures. Gradually reducing the dose under medical supervision is essential for long-term users. If you found this video helpful, don't forget to like and subscribe. Share your experiences and thoughts about using Meticorten in the comments below. See you in the next video.